Hi, I'm Monique. I'm going to be your nurse today. I know you had some complaining about some belly issues that you had going on, so I'm just going to go ahead and assess you. Um, Upon walking in, I'm just going to kind of look at the skin. I'm going to look at if there's any bulging from the stomach. Is it symmetric? Any belly rings, which she has a belly ring in. Does that look infected or any abscesses on that? And it looks fine. I'm just gonna see if her belly's rounded, looking at any spaces in between, things that just don't, are abnormal. Everything looks pretty good. Skin color is pink and moist. And then the next thing I'm gonna want to do is listen to bowel sounds. All her bowel sounds are normal, within normal limits. I've heard them within the first 10 seconds, so that's very good. Has everything been normal with your bowel movements?
Yes.
What's the consistency look like?
Formed.
Okay. And what's the color?
Brown.
Okay, good. No upset stomach, no vomiting, things like that. You're just kind of having pain. Okay. With the bell of the stethoscope, which I don't have the bell in mine because I left mine at work. I would listen to the midline here and see if there's any bruits there in that aortic line. Which I don't hear. I will also go ahead and listen for any femoral bruits as well. There are none there either. After I listen, I'm going to go ahead and do some light palpation on there. And that's just going to be some circular palpation. And you just tell me if there's any tenderness anywhere around here, okay? I'm also going to be feeling for any masses, anything that's unusual, feeling her skin temperature. Everything feels pretty good and warm. So that didn't hurt at all. And then I'm going to start feeling some deep palpation. And that's going to be with 2 hands. Just tell me if it hurts, okay? That hurt. And now I'm going to percuss. Sorry. And then we're going to start actually intercostal spaces from the upper chest. And if there's large breast tissue, you can also move that just so you can make sure you're getting some resonant sound. And so the first sound of dullness would indicate that's where we start for the edge of the liver. And I'll go ahead and mark that. And then I would start from the lower part, percussing until I feel or hear dullness toward the top. And then it would be here. The normal for that midclavicular line would be 6 to 12 centimeters. And I measured that, and that's about 9 centimeters. I will also percuss the belly. This would help us see if there's any masses, things like that. And her sounds are timpani, so that's good. There are also 2 ways into measuring for the spleen, and if there's any spleen enlargement, and that would be toward the axillary line here, and you would percuss down to hear any dullness. which I don't hear. And if it were to be enlarged, it may, you would hear that dullness. And then the next way to assess for the spleen would be, go ahead and take a deep breath for me, kind of down that same line. Then you would go in, and then you would also go to a dull point, which there's not. So neither of those signs are positive. I would go ahead and feel for it. Place my hand here and my other hand toward the back. Which I don't feel. So we have done that. There are,
Gallbladder.
Oh yeah. We are going to assess the Murphy sign now, and that Murphy sign is just going to indicate if there's any cholecystectomy, or not, I'm sorry, not cholecystectomy, but any problems with her gallbladder. Are you having any pain when I touch here? Okay, so I'm just going to go ahead and have you take a deep breath, and I'm going to go ahead and palpate it here. Now, if there were to be a problem, she would break that inspiration. So she would go ahead and, if I were to tap it here, she would kind of break that, like take a deep breath right after. So she did fine. There's no tenderness to that right upper quadrant, which would be indicative of some gallbladder problem. For appendicitis, we know that there's 6 ways, or 6 things to assess for possible appendicitis, which would be any muscular rigidity, which I'm not feeling. Everything is flat, smooth, normal. Any localized tenderness, which you're not having any right lower quadrant pain, right? Any tenderness to the right side of your rectal area?
No.
Okay. And now I'm going to go ahead and move your right knee. We're going to do the obturator sign here. And we're going to kind of bring that up, bring it out. Is there any pain right there in that right lower quadrant? Okay. And that's the obturator sign. And then, like I said, when palpating it, if there would be any sensitivity to the palpation, which there's not. We are also, I talked about the Murphy sign already, and then the McBurney sign. And that's just any tenderness, which we have already assessed. We did the obturator sign. And the colon sign would just be any discoloration around this umbilical area. And that could be indicative of any retroperitoneal hemorrhaging, maybe a AAA, things like that, which everything was good in color, which we assessed when we first started inspecting. Now we're going to assess, now we are going to assess for any fluid shifts for our patient that may have some ascites. Like I said, initially upon looking, I don't notice any rounding, any bulging bellies, things like that. And also we're assessing for hernias if there, like I said, any bulging, which there's not. And her belly's not rounded, it's flat. But, so I would start from the mid, percuss, and I would percuss out. So. And that's just to where the dull area is. And I would go ahead and mark that area. And then I'd have her turn this way toward me. And continue this. Which is still on the same side. So normally if someone were to have a fluid shift, that would not line up. And that is going to complete my abdominal assessment.